Thank you, everyone. It's good to be here representing Doctor.com. My name is David Brooks, and I'm co-founder of and search marketing consultant to Doctor.com. And I'm joined today by Scott Kera, Chief Operating Officer of Zwivel.com. Today, we're going to talk about an invaluable topic, not about how to get more patients, but how to get more patients to accept a treatment plan. So the first part of our presentation is about what makes patients call your practice. Why do they book? Why do they show up? And why do they even show up for a consultation? Then Scott's going to cover some innovative software platform that's called Zwivel.com that has been shown to double the case acceptance rates for cosmetic procedures. Although Scott's company deals primarily with cosmetic surgeons, the subject of today's webinar has relevance for virtually any provider that presents a treatment plan for a discretionary or cosmetic procedure: dental implants, teeth whitening, laser hair removal, skin treatments. The goal of our presentation is to provide you with the secrets to identify the best prospects and to drive down the cost of acquiring them. But first, a word from our sponsor, and that's Doctor.com. We provide software and services to automate marketing, reputation management, and patient acquisition. We only work for physicians, so we're uniquely qualified to work on local business marketing issues for the modern medical practice. Scott, maybe you can talk a little bit about Zwivel.
Sure, absolutely. So hello, everyone. My name is Scott Kera. I'm the Chief Operating Officer at Zwivel. Thank you very much for joining us today. To give you a little bit of background about Zwivel, Zwivel was founded by a plastic surgeon, and he founded it after he had one of those long, frustrating days where he saw a number of patients who didn't end up booking a procedure, so he decided to do something about it. And he originally founded the company in 2012, but it wasn't until we connected in 2014 that the platform actually began to come together. And what Zwivel does, and this will be an analogy I use later on, is that if what happens right now in your office is like a blind date where a patient comes in and they don't know the doctor and the doctor doesn't know the patient, we're kind of like a Match.com where you still have to go in for the consultation. You just want to make sure it's worth going in for and that you as a physician and staff member are not wasting your time. So I'll hand it back over to David.
Great. Thanks, Scott. Branding and the idea about what some of the problems of modern medical marketing. And this is a great quote from a web marketing guru by the name of Lisa Irby. And what she's saying is this, is that when you have your own brand that people trust, you can stop chasing money-making schemes. Making money is a tactic, and branding is a strategy to achieve that tactical goal. In short, build your brand first, then worry about getting new patients. So Doctor.com manages online reputation and directory listings for thousands of medical practices. And the one rookie mistake we see over and over again is when a provider gets on the bandwagon with the new thing. The provider tries some hot new marketing gimmick for a month or two, then quickly gets discouraged by the lack of results. Then they stop. Or they overspend without understanding ROI. Or they fire one agency and hire the next without understanding what the first agency did wrong and what the next agency is supposed to do right. This sort of activity makes us all want to kind of stop and shake the phone or shake the doctor and say, stop chasing money. The key takeaway is think about the long-term strategy to achieve your business results. What makes you special? Then focus on this in everything that you do. Dedicate a fixed, comfortable budget and stick with it. So what is your brand? You're correct to assume it's the usual things like your credentials, your education, your awards. It's your skills demonstrated by positive outcomes. Great before and after pictures, very moving, accurate testimonials, and also peer referrals. Those counts. And those are things that I think many doctors would agree is what differentiates them, make them special. Consider though, from the patient point of view, patients have a different checklist. Not necessarily. I mean, they do include those ideas, but think about this. What about your office? The design, the layout, the location. Is it convenient? Is it an attractive modern office? Your staff. Are they cheerful? Do they display a caring attitude? Are they well trained? Do they keep information private? Do they act with discretion and respect? Your policies. Is it easy to get an appointment? How long is your waiting time? Do you have a policy for hassle-free paperwork? Do you offer a savvy, friendly reminder for patient appointments? What do your online reviews look like? Online and also word of mouth reviews. What's your digital presence look like, both the accuracy and consistency of your listings online? Do you support local charities, local civics groups, sports leagues, etc.? And even things that seem innocuous but are very important, things like the design and look of your stationery, your logo. Does it look like a cheesy piece of clip art, or is it really professionally done? So it's important to think deeply about all of this. If you can't afford a professional market research company, ask patients and other people that you trust to give you an honest opinion. The key is to define the essential immutable attributes that make you irresistible to the broadest market of patients. Okay, so I can hear a lot of you hyper-rational left-brain doctors saying, well, branding is for snack foods, not for doctors. But consider this. Strong brands remove patient doubt. Branded providers compete less often on price, less negotiating with patients, less negotiating with payers. A strong brand is an excellent entry barrier to new competitors. Brands attract better patients and better employees. Providers with strong brands have more lucrative practices. Providers with strong brands get higher acceptance rates of treatment plans. Okay, so now that we've established, I hope we've established the importance of a branding strategy, let's look at the other crucial issue here, is that's persuasion. Getting a patient to actually call and schedule an appointment and getting them to listen to and accept the treatment plan. You can have an excellent strategy, dynamite lead generating activities, but your claims and messages need external validation before that phone's going to ring. One of the best forms of validation is social proof, independent, credible evidence that backs your marketing claims. This is especially important for cosmetic surgeons and cosmetic dentists, where the work is much more discretionary, and the patients pay mostly out of their own pockets and act much more like fickle shoppers wanting to be wooed. Today, your online reputation, which is reviews and online directory consistency, local search rank, that they deeply affect how these patients are going to perceive you. More importantly, with a great online reputation, it's essential that a great online reputation has to validate your offline reputation. They kind of work together. If you have great word of mouth, it's going to kind of match. Let me give you an example. Think about this. One of your recent patients meets a friend for lunch, noticing the obvious transformation from a surgical procedure maybe was done 6 months ago. They talk about the procedure, and your patient recommends you. So what's the number one thing that new prospective patient's going to do? She's going to go home and Google you. She's not going to call your office. How does your reputation look? How does your online reputation look? If it looks murky or lousy, it will literally snatch defeat from the jaws of victory. And sadly, this is kind of a referral leakage. It's hard to measure, but we think it's a true effect. And it's a big problem for too many providers. You lose business you should have gotten simply because the power of the personal referral didn't overcome your lousy online presence. So the first aspect of your online reputation is search rank and search profile. Think about the first page of search results when patients Google you by name. They got your name from a family member, family friend, neighbor, and another provider or an insurance company. Now they're checking you out before they call. They're making subtle judgments about what they see. Is your name, phone number, and address clear and consistent? Do I see the same name on each listing, or do I see signs of neglect, like your first and last name transposed? Are you listed on the top sites? What do those listings look like? Do those listings look claimed and cared for, or are they neglected and empty? Then there's some technical issues about your website that really turns people off, like, can I read your website on a mobile phone? Do the pages work, or are there lots of broken pages? Does the site take forever to load, like 1 or 2 seconds forever? People are very intolerant about even a 2-second lag on loading your website, especially on a mobile phone. So Google and other search engines have used these and more than 200 other data points in their ranking algorithms to determine top search rank. In plain terms, whoever is in your local trading area for your profession, their website is being examined, and Google ranks them as being the top provider in your area, based largely on these technical features. Many of these factors are within your control once you take ownership and manage your online reputation. So it sounds very complicated, and frankly it is. But fortunately, we've developed a tool that will quickly analyze all the major healthcare and local business directory websites to show how your practice appears to search engines. If you shoot me a quick email after this webinar, I can set you up with a free, no obligation review. We have an exclusive tool that will look at your web presence and give you kind of a rating score, so you can understand how good or maybe not so good your online reputation is. So let's talk about the other part of online credibility and social proof, and that's reviews. This is sort of a survey that we did a couple years ago, and let's get into the psychology of what people are thinking about from the viewer point of view. What do they, when they're looking for reviews about you online, how do they think? So we asked a couple of questions. The first is, when evaluating a doctor based on online reviews, what is the minimum number of reviews needed before you're considered that rating to be credible? And 2/3 of the patients think that you need to have at least 10 reviews to have a credible representation about your online reputation. So next we said, how many stars are enough? And here's what we found is that you need a minimum of 4 stars or more before anyone will call you. And this is kind of a very sobering statistic, but I think there's a lot of truth to this one. Honestly, most online reviews have about an average. I think the average is like 4.3% or 4.3 stars out of 5. So if you have less than 4 stars, it's probably a problem for your reputation. And there's a lot of studies that kind of bear this out. So you look at these first 2 slides and you might say, great, I've got 20 online reviews and most of them are 4 stars. So I guess we're done, right? And not quite. So we want to look and see about the age of the review. If they're old and stale reviews, you've got a problem. 25% of respondents feel that a review has lost all credibility if it's 6 months old. And by 12 months, that number has grown to 75%. 75% of people think that it's not a credible review because it's 12 months old. So the key takeaway here is on online reviews are something that you need to manage, and you need to have a way to keep them constantly fresh and constantly in the minds of the people that are reading them. We also asked the question about how many bad reviews are too many, and the answer is it's basically 1 out of 20. So if you have 1 bad review and 19 good reviews, that is probably the threshold. And so you want to really keep that balance high. It's not that hard, and we have some proprietary tools that will really help boost that kind of average, but people are looking kind of critically. We tell clients that the occasional bad review is not fatal. Most patients are open-minded and they see a fluky review and they kind of dismiss it. The occasional bad review also helps the process look objective and honest. You can't please everyone, and so the occasional bad review lets people know that it's not all just 100% paid for kind of reviews. But we warn clients not to let bad reviews define a trend. And we certainly don't advise that you let a bad review go unanswered. So pursue bad reviews with kind of a savvy combination of personal outreach, public outreach, and if necessary, appeals to the publisher for legitimate violations of publisher standards. And although it's tempting, avoid calling your lawyer. Those types of tactics rarely kind of work. So here's our solution to help get you more reviews. It's the Doctor.com Review Hub. It's an in-office review collection laptop running on the Google Chrome operating system. And it makes it fast and easy for patients to leave you an online review. It's basically sits at your checkout counter at the point of care where they're much more likely to engage. If they like you, it takes 2 or 3 minutes and they're out the door, they feel happy. If you send them a follow-up email, those compliance rates are extremely low. So we're getting some very good results. The average user of a review hub is getting about 8 times more online reviews than a user that's registered on Doctor.com but not using the review hub. And all those reviews are collected and then first moderated for quality, then published across the entire Doctor.com network, including websites such as Vitals, Dental Plans, Ask.com, You Compare Health, Healthcare, Wellness.com, and several more that were on the way. So that's kind of a brief overview. Let me just conclude with a couple of remarks here. I'll turn the mic over to Scott in just a second. So first, branding is a strategy to help you get more new patients that you want. So think about what makes you different, special, and unique in your region, then find distinctive and creative ways to reinforce that message to prospective new patients. Online reputation is your credibility. Clean online citations, fresh and positive online reviews provide the social proof that makes the phone ring, and it reinforces the credibility of your brand. Patients are much more likely to call and book an appointment when the audio matches the video, when a friend or provider's recommendation meets those expectations. And they're less likely to call when they see some of those warning signs, like I mentioned before, about a neglected or incomplete kind of profile. Like good health, getting patient reviews is a known process that can and should be managed. Strive for recency and freshness. Strive for high star ratings. Try to find ways to limit the bad reviews, and just make sure that the ratio is always, kind of that 20-1 or better. And get those reviews published on the sites that matter, not just on some random hidden review sites that no one goes to. And then finally, take the steps to make sure that your online reputation is really solid. Names and addresses should all look consistent. Your practice information should be rich and filled with lots of great content, professional quality photos, and a lot of good information about procedures, especially questions that, answering questions that patients might have. And compelling before and after shots are always, I think, very important for any kind of cosmetic surgeon or any kind of cosmetic procedures. And make sure that that good reputation is kind of consistently mentioned across all the different important directory sites. Okay, so now it's my pleasure to turn the microphone over to Scott. I'm going to switch the slide screens here, so bear with me. And then Scott will give you kind of a more in-depth version about Swivel. Okay.
All right. Well, thank you very much, David. I appreciate it. Hello, everyone. Thanks again for joining us today. So as I mentioned earlier, Swivel was founded by a plastic surgeon, and it was solved to something we to solve something we call the consultation conundrum. So if you look at everything that's out there today, most of the industries focus on increasing the number of cosmetic patients that are driven to your office. None of these current cosmetic website industry strategies address the enormous inefficiency that is characteristic of the consultation process in cosmetic medicine. And that is that just by getting more cosmetic patients to contact you does not mean that you'll necessarily perform more procedures. So if you look at this chart here that was published in the Business of Plastic Surgery, you'll see that the net scheduling rate was about 36%, or more than 64% of the patients who came in opted not to actually receive a procedure. So if you kind of look at that, that would mean that for every 10 new cosmetic patients that come into your office, more than 6 will not have a procedure with you. And if you look at it by time, and if you were to average that one new cosmetic patient takes up about 1 hour, for every 10 new consults that you see, you would have wasted more than 6 hours of your time seeing those patients. And for every hour that's blocked off with a wasted consultation, it could have been spent with a patient who would have had a procedure with you. And it's a waste of time for patients too. 90% of cosmetic patients are women that are very busy and time constrained, that have jobs, children, or both. So it's not easy for them to make it into your practice. And in fact, Allergan about a year ago published a study saying that there's 10 to 15 million potential cosmetic patients on the fence. And they said the reason there were so many people on the fence is because it was difficult for them to make time to come into the office. And they don't have time to waste from going on unproductive, from time to go from unproductive consultation to unproductive consultation. So why is this number so low? Well, there's a number of contributing factors and causes. One is the informational or unserious group, which actually makes up the smallest percent. Most patients don't go into your office expecting to waste your time or wanting to waste your time. They just didn't know the answer to something that they found out during the consultation. The biggest one, which I'm sure many of you have dealt with, is financial. They can't afford it. They're shopping around. They thought insurance covered the procedure, but it doesn't. Or preferential. Some people prefer one doctor over another, and it can also result in the procedure recommendation. Perhaps the procedure recommended was different than they expected. One thing we always hear here at Swivel is that my friend had one procedure, I thought it was right for me, and now you're telling me I need something else. Or familial. Maybe their family won't allow it. And then there's also the medical reasons. Maybe they're not medically clearable, or the patient doesn't like the risks of actually having the procedure. So factors that contribute to the problem are typically not apparent until the end of the consultation. After the consultation has been completed and after both you and the patient have already wasted your time. And this is what we call the consultation conundrum. So there's been numerous attempts to solve this. One has been listing fees on the website. The only issue with that is that not all patients are the same. It isn't one size fits all, and not all procedures are the same. And then there's also charging for consultations, which is a common one, and it's something we always hear. Should I charge for consultations or should I not? But this is only effective toward the informational and serious patients. So the ones that you assume are going to waste your time, you'd like to collect some money from. And this creates a potential barrier for patients, right? Because instead of having a beware of dog sign, you're essentially saying beware of the consultation fee. So if you were to look at the numbers, if on average a consultation fee is about $100, and the average surgical procedure is $5,000, you would have to see 50 patients that pay you a $100 consultation fee to make up for one patient who was serious but didn't want to pay the consultation fee, so they had a procedure elsewhere. And then there's also pre-screening patients. So we've heard various attempts. Some people do it over the phone. Some people do it once the patient comes into the office, but it's very transparent to the potential patient. Many of them know what you're trying to do. And then there's virtual consults. So far, there's been a lot of people who decided to take it upon themselves to build one on their website, but a lot of them are very primitive. They're not widely used. We hear from patients that they feel as though they're taking an exam when they go through it. Zwivel used to be a free practice management tool. We are currently offering a free trial, and we'll let you test it out. But after that, there is a monthly subscription fee. It's fully HIPAA and high-tech compliant. All communications are private and secure between each patient and each doctor. And it initiates and streamlines the cosmetic consultation process, saving valuable time for both cosmetic doctors and patients. I do want to point out that this does not replace the full in-office consultation. So to refer to my analogy that I made earlier, if you were to consider what happens now like a blind date where the patient doesn't know you and you don't know the patient, this is like Match.com, where you're essentially going through the process so that when the patient comes in, they feel like they already know you. So here's a little quick clip on how Zwivel works.
Keep your cosmetic practice open 24/7 with Zwivel's virtual consultation plugin tool. And grab potential cosmetic patients before they have a chance to contact your competitors. Patients who visit your website begin by telling you their cosmetic concerns and desired procedures. If there's more than one area they're interested in, they can select those as well. They can then upload photos of each area they've selected and tell you their budget and time frame for their desired procedures. They can also give you other information you will want to know about them, and record a video and text anything else they will want to share with you. Then they'll review everything they've added and click send. You'll be notified when the request arrives, just like getting a new email. You can quickly review their information and what they're interested in having done. Then, quickly and easily reply back at your convenience using Zwivel's Save Templates and Reply apps, giving your opinions and recommendations with estimated fees, and whatever else you want the patient to know. The patient can then review your reply and let you know if they want to come in for a full consultation. It's that easy. But there's more. Cosmetic doctors who sign up for Zwivel are automatically featured in the member directory on Zwivel.com. So, you will receive requests from additional patients searching for cosmetic doctors in your area. So sign up and create your Zwivel account now. Zwivel, not just more patients, more qualified patients.
So with that, thank you very much. I greatly appreciate your time. I wanted to hand it back over to David, who I think will round this out.
Great. Well, let's wrap it up. Thank you very much for the introduction to Zwivel. It's a fascinating platform. Doctor.com is partnered with Zwivel to allow reviews from selected providers to appear on the Zwivel platform. So we're always interested in expanding our network and I think supporting some very innovative software programs. And thank you very much. We look forward to your questions and comments, and please look for our next webinar coming up in 3 weeks. Thank you.